our healthcare system. Debate, the Honourable Member for Vancouver Kingsway.
Thank you, Mr. Speaker. Mr. Speaker, it is a great privilege and an honour for me to rise on behalf of my colleagues in the New Democratic Party caucus and on behalf of the New Democratic Party of Canada and all of those Canadians from coast to coast to coast who care so deeply about our healthcare system. I think it is timely to note at this time that Canadians find themselves in the grip of what I think can fairly be called a major public health crisis, the COVID-19 public health outbreak that I think is affecting communities across our land. And I think the one thing that Canadians feel extremely proud and strong about at a time like this is that we have a strong public healthcare system that helps keep everybody healthy across this country and responds to keep people healthy, and most importantly, regardless of anybody's ability to pay, but rather as a birthright of citizenship in this country. And that's why it gives me a great pleasure to stand today and speak to an issue that I think represents an immediate, urgent, and critically important gap that exists in our current healthcare system, and that is the lack of public coverage for prescribed pharmaceuticals, the medicine that Canadians need and as their doctors prescribe. I'm going to cover four basic elements in my remarks today, Mr. Speaker. I'm going to read the motion. I'm going to discuss the need. I'm going to discuss the solution, and I'm going to talk about the responsibility that we have as legislators in this country. First, the motion. The New Democrats propose that this House acknowledge the government's intention to introduce and implement national Pharmacare, call on the government to implement the full recommendations of the final report of the Hoskins Advisory Council on the implementation of national Pharmacare, commencing with the immediate initiation of multilateral negotiations with the provinces and territories to establish a new, dedicated fiscal transfer to support universal, single-payer, public pharmacare that will be long-term, predictable, fair, and acceptable to provinces and territories. Urge the government to reject the U.S.-style private patchwork approach to drug coverage, which protects the profits of big pharmaceutical and insurance companies, but costs more to Canadians. And finally, recognize that investing in national Pharmacare would help stimulate the economy while making life more affordable for everyone and strengthening our healthcare system. Mr. Speaker, I want to briefly review the need, the context in which this motion emanates, and what's really happening in all of our communities across our country. Right now, as we gather today, 1 in 5 Canadians, that's 7.5 million people, either have no prescription drug coverage whatsoever or have such inadequate or sporadic coverage as to effectively have none at all. Currently, each province offers different levels of drug coverage for different populations, creating significant, profound inequalities in prescription drug coverage between regions. Third, Canada currently does have a U.S.-style patchwork of more than 100 public and 100,000 private drug insurance plans. 1 in 5 Canadian households reports a family member who, in the past year alone, has not taken a prescribed medicine simply due to cost. Nearly 3 million Canadians per year are unable to afford one or more of the prescription drugs their doctors prescribe as important and sometimes essential for their health. Of those 3 million Canadians who cannot afford their medications, 38% do have private insurance and 21% have public insurance. But these insurance plans are not sufficient to cover the medicine they need. 1 million Canadians per year cut back on food or home heating in order to pay for their medication. 1 million Canadians per year borrow money to pay for prescription drugs. Canadian adults are 2 to 5 times more likely to report skipping prescriptions because of costs than residents of comparable countries with universal pharmacare systems like the United Kingdom. In fact, Canada is the only country with any modern economy that has universal healthcare coverage that does not provide some form of universal access to prescription coverage. A recent study from the Canadian Federation of Nurses Unions reveals the human costs of this problem. They have found, just studying 3 different serious health conditions, diabetes and heart disease, that every year up to 1,000 people die purely because they don't have access to the medicine that would save them. I want to repeat that. That means that there are thousands of Canadians, if we include all medical conditions, thousands of Canadians, maybe tens of thousands of Canadians, who die unnecessarily, prematurely, because this country simply does not provide them with the medicine they need. Now, on the other hand, despite this horrific deficit in human terms, economically, Canadians perversely consistently pay among the highest prices in the world for prescription drugs due to our fragmented patchwork of drug coverage. In fact, prescription drug spending in Canada has increased every year since this Liberal government took power in 2015. Now I'm going to pause, because in 2015, this Prime Minister gave a mandate letter to then Minister of Health Jane Philpott, and in that mandate letter he specifically tasked her as a major goal with reducing the cost of prescription drugs in Canada. Well, I think Canadians know anecdotally their access to drugs has not increased in the last 5 years, and they know that the price of prescription drugs certainly has not gone down. But what I did is I wanted to get the scientific answer to that question. So 2 months ago, I wrote a letter to the Canadian Institute for Health Information, CIHI, and I asked them to tell me what's happened to drug prices in Canada since 2015 and the Liberals took power. And what they found was shocking. They found that both on absolute terms, Canada as a country has spent more money every single year since this government took office on prescription drugs. And on a per capita basis, each Canadian in this country has spent more money on prescription drugs every single year since this government came to power. So that mandate that was given in 2015 to reduce prescription costs not only has completely gone unfulfilled, it's actually gotten worse. From an institutional point of view, prescription drugs represent the second largest category of spending in Canadian healthcare, surpassing spending on physician services. Only hospitals, what we spend on hospitals, costs us more as a nation than what we spend on prescription coverage. Now, what happens when patients can't afford their prescription drugs, besides get sicker, which I'll talk about in a moment? They access provincial and territorial health systems more often as their condition deteriorates. In 2016, about 303,000 Canadians had additional doctor visits, about 93,000 sought care in emergency departments, and about 26,000 were admitted to hospital after being forced to forego prescription medication due to cost. Healthcare Can, the national voice of healthcare organizations and hospitals across Canada, estimates that between 5.4 and 6.5% of all hospital admissions in Canada are the result of cost-related non-adherence to prescription medication, resulting in costs that they estimate cost us at least $1.6 billion per year. Now, it's been almost 1 year and a parliament and a general election ago since the final report of the Hoskins Advisory Council on the implementation of National Pharmacare issued their report. And what was the conclusion of that Liberal-appointed committee, headed by a former Liberal Minister of Health from Ontario? A committee that crossed the country, listening to consultations from every stakeholder group across the country. What did they recommend this government and this parliament to do? They said Canada must implement universal, single-payer, public pharmacare and get started on it now. Now, not only that, but they gave us a blueprint. The Hoskins Advisory Council told Parliament to work collaboratively and in partnership with provincial and territorial governments to begin the implementation of National Pharmacare in 2020, right now. They advised that we should have federal legislation in place by January 1, 2022 that outlines how governments will work together and share costs. They listed federal responsibilities, and they said that legislation must include the steps required for provincial and territorial governments to opt in national pharmacare. That is in less than 2 years. They said Parliament needs to act immediately so that we offer universal coverage for at least a list of essential medicines by January 1, 2022. That's about 20 months from now. They suggested that we implement a detailed national strategy and distinct pathway for funding and access to expensive drugs for rare diseases by January 1, 2022. And they said that this country needs to offer a fully comprehensive formulary covering all medicines that Canadians need, that are cost-effective, that are required to keep them healthy, and covered by a public single-payer system no later than January 1, 2027. Now, Mr. Speaker, Liberals often accuse the NDP of being in a hurry. Now, let me just pause for a moment and review the history of pharmacare. It was in 1964 that the Royal Commission on Healthcare, chaired by Justice Emmett Hall, who was appointed by Conservative Prime Minister John Diefenbaker, issued a report to Canadians saying that Canada needs to offer prescription drug coverage in this country. That's almost half a century ago. It was 23 years ago, in 1997, that the Liberal Party of Canada promised Canadians in a platform, in writing, that if they were elected and given the privilege of serving as government, that they would bring in public pharmacare and that they would produce a timeline in that parliament for doing so. Now, incidentally, the Liberal government has had at least 3 majority governments since then and a minority. They've had 13 years of majority government and minority government to make that happen since that time, and they have failed to do so. So I ask, is half a century for bringing necessary medicine to Canadians too much of a hurry?
Not at all.
Is 23 years to have a political party deliver on a promise that they made to Canadians in a solemn platform, in a public way, is that too much of a hurry?
Not at all.
Is almost a year that's passed since a Liberal-appointed advisory committee recommended the same thing that 7 different royal commissions, task forces, Senate committees, House of Commons committees, and 4 of all types have recommended and come to the same conclusion. I want to pause and emphasize that. Every single body, Mr. Speaker, that has ever looked at this question of how what's the most effective, efficient, fair way to make sure every Canadian gets the medicine they need when they need it, is through a public single-payer model. Well, Mr. Speaker, the NDP doesn't just talk, we act. We don't just dawdle, we work, we create, and we deliver. So the NDP has done the work that the Liberals promised to do and have failed to do, and that the Conservatives refuse to even commit to. And that is, we have drafted the very first historic groundbreaking legislation to make pharmacare a reality, the Canada Pharmacare Act, and we'll be introducing that legislation in this House of Commons in the weeks ahead. Now, what does that act do? Well, it's based on the recommendations of the Hoskins Advisory Council, along with the other expert reports, and we've modeled it on the Canada Health Act. Why? Because prescription medicine should be covered, Mr. Speaker, like every other medically necessary service through our public health care system. Our act would enshrine the principles and national standards of Pharmacare in federal legislation, separate and distinct, but in parallel with the Canada Health Act. That means that the federal government will take a leadership role and ensure that pharmaceuticals are delivered to Canadians just like we deliver other services, with provinces respecting the principles of, thank you, Mr. Speaker, universality, comprehensiveness, accessibility, portability, and public administration. Like the Hoskins report, our legislation would come into force exactly when the Liberal Dr. Hoskins said it should, January 1, 2022. And what it does is it says that the federal government should take leadership by providing a stable fiscal transfer to the provinces that agree to respect the principles of this act and make sure that their citizens get the drugs that are covered on a negotiated formulary at no cost, just like they do every other medically necessary service. Now, I want to just pause for a moment to those that think we can't afford it. Study after study, from the parliamentary budget officer to academics, says that we can cover every single Canadian in this country and save billions of dollars doing so. The parliamentary budget officer, using conservative assumptions, said we will save $4.2 billion every single year by bringing in public pharmacare. Academics have said that's a low estimate and it'll be billions more than that. Why? Because by bringing it under our public healthcare system, we can have national bulk buying led by the federal government for 37.5 million Canadians. We can have streamlined administration and take those 100,000 separate private plans and fold those into a single, streamlined, efficient, effective administration program in each province. Because we will save money from the results of cost-related non-adherence, because we know when Canadians don't take their medication, they get sicker. And when they get sicker, they end up in ICU. It's been estimated that for one diabetic who ends up in the ICU for 3 or 4 days because they don't take their insulin, it costs more money in that one episode than to give them free insulin for life. Wow. That is the kind of example that we're talking about, and we will save money by doing that. And finally, we will save money by a disciplined, evidence-based formulary, by having an independent body in this country who assesses medication based on science and the best value for money and efficacy. And that will form the basis for prescribing practices in this country and better prescribing practices. Mr. Speaker, it's time to act. Canadians can't wait any longer for this. They shouldn't have to wait any longer for this. This is an essential healthcare policy initiative. It is essential from an economic point of view. We have found that your average Canadian family will save $500 a year by public pharmacare, and your average employer will save $600 per insured employee. I want to say that I have rarely seen a public policy that has broader stakeholder agreement than public pharmacare. Outside of the pharmaceutical companies and outside of the insurance companies, every single stakeholder group who appeared before the Standing Committee on Health said they support what the New Democrats are proposing. Employers support it. Why? Because they know that they want to have a healthy workforce, and they know that pharmaceuticals are the fastest growing, the most expensive part of their extended private healthcare plan, and they can't afford it. They know that it's better to have this delivered through the public healthcare system. That's why Canada spends less money per capita than the United States does in delivering healthcare, and we cover every single Canadian. So, Mr. Speaker, it's time to act. I no longer want to hear this Liberal government give excuses about why they can't move faster in their studying and they have work to do. Do you know, I have never heard this Prime Minister or this Health Minister, in fact, any Liberal Health Minister since 2015, ever utter a commitment to public health care. Now, I've heard the Liberal Finance Minister tell his business colleagues that he prefers a US-style private-public patchwork, but there's been radio silence from this government on public pharmacare. That ends today. I challenge my Liberal colleagues to stand in this House today and tell Canadians, do you or do you not support public pharmacare, or do you support a private US-style patchwork? Canadians deserve to know. And after 50 years of study after study telling us that we need pharmacare, Canadians need it, And the New Democrats are going to continue to fight for patients and do what we've always done, which is create and build public health care in Canada, just like Tommy Douglas envisioned back in the 1940s. We're going to continue working hard until every Canadian has Pharmacare, dental care, eye coverage, auditory coverage, and full comprehensive coverage under a public health care system. Thank you, Mr. Speaker.